Hello, everyone. Thank you for joining us for today's webinar on My Heart, Women Share Personal Journeys with Heart Disease. My name is Lindsay Miltenberger, and I am the Chief Advocacy Officer for the Society for Women's Health Research, or SWHR. SWHR is a more than 30-year-old national nonprofit dedicated to promoting research on sex differences in disease and improving women's health through science, policy, and education. At the outset, we would like to thank Women Heart for co-hosting today's event. We are so grateful for Women Heart's leadership to drive advancements in women's heart health and for the team's continued partnership and collaboration with SWHR. I would also like to thank SWHR's Heart Health Policy Program sponsors, Amgen and Novartis, for making today's event possible. Before we pivot into today's program, I would like to review a few housekeeping notes. Please note that today's web event is being recorded and will be posted online. We'll also be sending out the recording and any resources mentioned in the follow-up email to registrants. To ask a question to the panelists during this event, please use the Zoom Q&A function. Alternatively, you can use the chat function, and we will plan to ask questions at the end of the event following each of the panelists' presentations. If you need technical assistance, please feel free to write in the chat as well, but please note that we'll have limited ability to assist while the webinar is running. So today we are joined by three stellar women who are involved in the heart health space. Selena Gore is the CEO of Women Heart, which is the leading nonprofit focused on greater awareness and education on the #1 killer of women. Prior to serving in this role, Selena served as the executive director of the Global Alliance for Chronic Diseases, where she led the GACD Secretariat, which funded research in over 70 countries around the world. She also worked in the field with the United Nations Population Fund and UNICEF in Angola. Lynette Blois is a licensed independent clinical social worker and has been a psychotherapist for over 30 years. She is originally from Puerto Rico and currently resides in Massachusetts. She's held roles with the Cooley Dickinson Hospital and the Center for Counseling and Psychological Health at the University of Massachusetts Amherst. And Lynette developed atrial fibrillation in 2008 and in 2019 became a Women Heart champion. Today, she's an active supporter of women with or at risk of heart disease. Rolanda Perkins is a training officer in the Office of Training and Professional Development at the Department of Children's Services. She had a heart attack at the age of 39 and in 2008 became involved with the American Heart Association and later its Go Red for Women campaign. In 2011, she began volunteering with Women Heart. She became a champion facilitator and was recently named a Women Heart Champion District Leader. So I would again like to thank our panelists for joining us today. This particular webinar is part of a broader heart health policy program that SWHR is engaging in this year. So as part of this program, we started off by convening an interdisciplinary roundtable of experts spanning from researchers and clinicians to patient and patient advocates to policy experts to really identify the policy gaps and opportunities within the women's heart health space. And from that, we're continuing on that work to produce several different things over the next several months. So one of which is this webinar. We really feel like it's important to highlight the patient experience and to really put a face with women's heart disease. So we're really glad to be engaging in this conversation today. But beyond this particular event, part of our work will be producing a one-pager on factors affecting women's cardiovascular health across the lifespan, and then ultimately culminating in the launch of a heart health policy agenda in February of 2024. So we hope that you'll stay engaged with us over the next several months as these materials are released. And then I would also like to acknowledge members of SWHR's Heart Health Policy Working Group who participated in the roundtable discussion last month. And again, would like to thank our current panelists today for building upon this work and bringing additional light. So with that, I will turn it over to Selena to walk us through women's heart disease scope and burden. Selena, over to you.
Lindsay, thank you so much. And thank you again to the Society for Women's Health Research on partnering on this topic. You know, we never excuse my dog. We never have enough attention on heart disease in women. That is the premise that we wake up with every morning. And so we are forever grateful to SWHR for highlighting this and for raising up the patient voice, which is another theme of the work that we do at Women Heart. So before we get to really the highlight of the hour and hearing from Lynette and Rolanda, I wanted to just set the stage for why this conversation is so important today. As Lindsay said, cardiovascular disease is the #1 killer of women. In fact, it kills more women than all forms of cancer combined. And the real tragedy about this is that not only is that true, but less than half of women know that in the United States. And so part of our mission is really to raise that number. The last time we did any research on the topic, only 44% of women recognize cardiovascular disease as our greatest threat. We also know that women living with some form of cardiovascular disease make up 45% of the adult population. And so women over 20. So, and a lot of those women don't know they have it. So that's another reason why raising awareness is really, really important. We also know, in addition, that about 50% of women who enter pregnancy don't have good heart health. And, for some of us, we learn about our cardiovascular disease when we go through pregnancy, right? So this is another really, really important feature of why it's so important to raise awareness about it. In addition to it being the #1 killer of women, it's the #1 killer of new moms. So over a third of maternal deaths are caused by some kind of cardiovascular disease. And we know that Black women have some of the highest maternal mortality rates, and that's alarming and something that Women Heart is trying to tackle. So, I hope that sort of gives you a sort of a broad picture for why this conversation is so important. In addition, Women Heart is celebrating its 25th year anniversary next year. And we have been around for as long as we have because the need is so immense. And our mission is to support, educate, and advocate for women living with and at risk of heart disease. Supporting women with fantastic Women Heart champions like Lynette and Rolanda around the country so that no woman has to go through their heart journey alone. We educate women through health fairs, webinars like this, events at churches, events, in online with perhaps your companies, to really raise the bar in terms of not just raising awareness, but encouraging women to take action on their heart health. And then we advocate. We bring Women Heart champions to Washington, D.C. to advocate on the Hill, to talk to their representatives about how important it is to consider women's heart health when they are legislating health policies. And that's something that a lot of our champions are equally passionate about, is the advocacy aspect of our work. So you can see, in these 25 years, we have really built a sisterhood of champions who are committed to helping women and committed to thrivership within the context of still living with heart disease. It's something that we are really passionate about, and we know that the need continues to be great. The trends aren't going in our favor. We for decades, until the early 2000s, we had significant drops in heart disease, and now we're seeing that trend going back up, which is why this work is more important than ever. So with that, I just I hope you see why we really have to have more of these conversations ongoing. So, like I said, really the highlight of today's conversation is hearing directly from patients. And so I want to turn it over to Lynette. Lynette is, as Lindsay said, is based out of Boston, and runs a support group there. And as I have mentioned before to others, we have women calling from other parts of the world wanting to join Lynette's support group, because that connection to women understanding in depth what it's like to live with heart disease is so critical, and so wanted. So Lynette, I'm going to turn it over to you.
Thank you. So I feel extremely honored to be here today. So thank you so much. So my name is Lynette, and to put it into context, I'm 71 years old, and I have heart disease. And I'm going to be reading to you my history because it's quite complicated. Saying those words that I have heart disease did not come easy to me. Not because I am not an educated woman, but because during my journey, nobody cared to tell me this was the case. October 2019, I had the honor of being invited by the Women Heart Organization to be trained as a Women Heart Champion at the Mayo Clinic in Rochester, Minnesota. When I arrived home, my husband tenderly asked me what I had learned, and for the first time ever, I was able to say, I have heart disease. My heart disease journey probably began years before it was diagnosed in 2008. My earliest memories are from when I was a teenager, and I would suffer from blackouts without passing out, and later episodes of dizziness that were never explained by any medical doctor. My mother tried taking me to doctors who never took the time to consider looking into the possibility that these symptoms could be related to a heart condition. And so for years, when the years went by until after I moved to Massachusetts from Puerto Rico. And in my ignorance, when I felt what I thought was my heart jumping in my chest, I took myself to cardiologist. I also have to say it was the first time I had health insurance. I also was head of household. So I had the freedom to seek out medical care. But that is another story to be told. I was then diagnosed with mitral prolapse, and I was told that if I went to the dentist, I was going to need prophylactic care. Many years later, this protocol was changed, and I no longer was considered to have this condition. Now it's Thanksgiving of 2017. My daughter and husband are newlyweds, and they invited me and my husband to his parents' house to celebrate Thanksgiving. I don't drink. We came home and I went to bed early. At 10:30 p.m., my heart began to beat erratically. But like a good Puerto Rican mother, I did not want to worry anyone. So I stayed put in bed all night, not knowing what was happening with my heart. I knew that my nephew, who was at medical school, was at my sister's house. So in the morning, I called her and asked her to tell him to bring his stethoscope to my house to listen to my chest. Exactly 12 hours later, at 10:30 in the morning, my heart stopped beating erratically. So he never got there on time to listen to my heart. I had never in my life been depressed before this event. And for the first time, I felt that way as I counted the hours for Monday to come by so that I could call a cardiologist's office to be seen. Long and behold, I was seen by a senior cardiologist who listened to me and my chest, and in a very sarcastic way proceeded to say, I know what you had, but I am not going to tell you. I was in shock. He then continued to tell me that if it ever happened again, I should go to the emergency room so they could document what was happening. But then in July of 2008, on a very hot day, as I was cleaning my car, I should say detailing my car, I began not to feel well. I thought I was dehydrated, so I began to take fluids, but the symptoms got worse. And so I told my sister I needed to go to the emergency room. She wanted to drive, but I knew something was very wrong and I didn't trust anyone, so I drove myself. I remember the room was full of what I think were nurses and a woman doctor. My sister was sitting in front of me, and her eyes were so wide open they were about to pop out of her sockets. And she looked at the monitor behind me. Later, I found out that she was looking at my heart rate. And so this day, I still don't know what it was like. All I know is that the woman doctor told me that she had to stop my heart with medication. And I said to her, you don't see my husband here. You don't see my children here. You don't see my grandchildren here. So you cannot do that. To which she replied, I have no time. So I had no option. She explained to me step by step what I was going to feel as the medicine entered my body, and she was right. I felt relieved. My husband arrived. I was hospitalized. And in the morning at 6 a.m., I was already eating breakfast. My husband was sitting next to me. My daughter and her husband were behind me. When nurses began to show up in the room, congratulating me because I had converted. I had no idea what they were talking about. And then this very tall man in a white coat with a stern look in his eyes walked into the room and looked down to me while he said, you're stupid, very stupid, so very stupid. And I was looking at him in disbelief, but then looked down and said, my behavior might have been stupid, but I am not stupid. He turned pale and proceeded to say that he was leaving a prescription at the nurse's station and that he would see me next in his office. The interaction was the preamble to many uncomfortable visits with this electrophysiologist. I had the opportunity to talk to several women during the next few years who all conveyed that they had been the victims of his behavior and mistreatment. For the next 6 years, I continue to have episodes of what I now know was atrial fibrillation. I had been told that I could have the pill in the pocket, meaning that I could take a cocktail of pills and lay down in bed until I felt better, instead of coming to the hospital when I was in atrial. The episodes were so violent that either I would shake like a leaf in the wind or be so incapacitated that my husband would call an ambulance or drive like a maniac, sometimes escorted by police, to get me to the hospital as soon as possible. These episodes will happen at work, at the airport, when I was traveling, during the day or night, and it seemed as if they happen every other week. I learned to quietly look at my husband and he just would say, you have it. And he knew we had to get going. On one occasion, we were at the hospital and the doctor gave me the medication, but after a few hours, I had not converted. So he decided to hospitalize me. It was around 11 a.m. At 6 p.m., I converted and I asked my family to please go home to rest. At 9 p.m., I felt I was drifting away when I saw a group of nurses and a doctor storming to the room screaming, asking me what my name was and my date of birth. While they were wheeling me out of the room with a defibrillator next to my legs to the CCU. I then saw my husband and son crying, putting together some pillows on the floor to sleep next to me. To this day, I do not know what happened to me. Another time for months, I had been complaining that every often during the day, I fell to the floor. I never hit the floor, but I had to hold on to a desk or a chair not to fall. The doctors didn't take me seriously until I could no longer take it, and my daughter took me to the hospital. In the emergency room was a nurse practitioner who confirmed that she knew me and that I was not somebody to complain or be so sick as I was that day. I was in the hospital for 5 days until they found out it was the metoprolol, the medication they were giving me for my heart rate. At that point, they were going to send me to a rehab center, but I decided I was going to rehab myself on the floor, and I left home again, walking. It was not until 2014 when, at the recommendation of one of my trauma work colleagues, that I began to see a doctor in Boston. Once again, I ended up in the hospital near my home with Atrial. Once more that day, my sister had offered to bring me in. Suddenly, all the alarms were screaming that there was something wrong. This time, my sister left the room running, and again, a bunch of nurses came rushing in while another woman doctor was directing them like an orchestra director. This time, I knew something was seriously dangerous happening. So I asked her if she was a doctor, and she said yes. Then I asked her, am I dying? And she answered, not yet. Why do you want to know? And I said, because I want to prepare myself. She began to scream, asking to get her cardiologist now. A male doctor walked in and told me, don't worry, I know what you have, and I'm going to help you. He proceeded to do a cardioversion. Then I was told I had atrial fibrillation. I had atrial flutter, sorry. My doctor in Boston called me and said he was going to start me on Xarelto. It was at this point that for the first time, a doctor had thought of giving me a blood thinner. He also told me in 2 months, he was going to perform an ablation. Unfortunately, the ablation did not work. He tried again in 2016. By then, I could not take flecainide or metoprolol, and he could not do any more ablations. My husband and I went to Stanford Hospital in Palo Alto, California, in May of 2017 for a second opinion. Unfortunately, there was nothing they could do for me. During my next visit with my doctor in Boston, we were very excited to tell him about a trip to Stanford. He became furious, screaming at the top of his lungs. My husband distracted him while I got dressed. His fellow was very kind to me during this incident. We left, drove back home for 2 hours, and upon entering our house, my husband whispered to me, I hope you never see that man ever again. I spoke with my primary care physician, and together we decided to try a doctor in Worcester, a city about an hour and a half away from my home. On my first visit with this amazing doctor, I knew he was a compassionate, dedicated physician. He talked to my husband and me and said that he was going to do everything possible to help. On my second visit, he had already arranged for me to meet with a woman surgeon. And in less than 2 weeks, on May 8th, 2018, I had a conversion ablation with concomitant atrial left atrial appendage deeping. The surgery lasted 9 hours, and I never experienced atrial fibrillation again, aside from 14 beats now and then. I continue to be on Xarelto. In January of this year, I became symptomatic with heart palpitations. In February, I was diagnosed with SVT. I had lost my doctor by then, the only one who took care of me with dignity and compassion. But believe me, it was for a good cause, as he was promoted to be the professor and chair of the Department of Medicine at his university. I still could send him an email, and he replied to me immediately, giving me advice about this new diagnosis. Since then, I have seen 3 different doctors, and even though the last one seems to be the one I'm going to stay with, I still need to make sure I am making the right choice. I have a nurse practitioner at my primary care doctor's office who has been diligently taking care of me as well. In the last 5 years, I have changed my diet to a healthy diet. I exercise 6 days a week. In the summer, I walk 4 miles. Recently, I developed long COVID, and the recovery has been challenging. Nevertheless, I have continued my exercise routine as much as possible. I keep my appointments with my doctors, check my blood pressure at home, and take my medications faithfully every day. Atrial fibrillation is considered, for the most part, not to be a life-threatening disease. However, this has not been the case for me. I wish I had asked more questions from the beginning of my heart problems. I wish I had talked to the superiors of doctors who did not treat me with respect. I fully understand what it is to be a Puerto Rican woman in this society and the hurdles we must jump to prove that we have a working brain and that we deserve to be treated with respect and dignity and without projections of their ideas of what we are about. Unfortunately, I come from a privileged position because of my family of origin, my education, and my socioeconomic status. But I heard for my fellow sisters who don't get the same treatment I do and don't have the resources to protect themselves. I do the work I do and fight for better care because my heart disease is genetic. And I think especially of my daughter and 3 granddaughters who are the most vulnerable in inheriting this disease. I am positively stubborn that we can win this battle and fight for it every day. Thank you.
Thank you so much, Lynette. That is a compelling story, and I feel like we travel that road with you as you shared your story. You know, it is just a testament that you are so strong to be able to share that story despite how challenging it was for you to travel. So thank you. I'd like to turn it over to Rolanda to hear about your experience, Rolanda. And then, as Lindsay said in the beginning, I'd love to invite the participants, if you have questions for Rolanda, for Lynette, or for myself, please do enter it in the Q&A, and we will come to it once we're sort of finished with the program. So Rolanda, over to you.
Thank you, Selena. I am Rolanda Perkins, and I live in Tennessee. Today, I am 57 years old. When I was 39, I had a heart attack.
Birthday.
Oh, thank you. I did just have one at the end of August, so thank you. Um, but when I was 39 years old, I had a heart attack. And it was right after my 39th birthday. So at that time, I was working third shift. And so I wasn't getting really good sleep, but I was getting the sleep that I could get working third shift. But I was also planning a party for my sister's 40th birthday party, for her 40th birthday. So I had a lot going on. And as I was planning the party, I kept getting a headache. And I thought that my headache was a migraine, even though I've never experienced a migraine before. But the headache was so intense that I just figured that's what it was. So I was doing a lot of self-diagnosing because I didn't go to the doctor. I was self-medicating as well. I was taking Excedrin for migraine because I thought it was a migraine headache. So I just kept going. I kept planning the party. And after the party, that was a Saturday, I had a cookout on Sunday because I still had family members in. And so I was doing a lot that weekend. So the consistent headache that I had that I never went to the doctor for, that was my only symptom. Sunday night, as I was cleaning up my floors after everyone had left from the cookout, I felt a pain in my chest that I had never felt before. And I figured that that pain was just indigestion. I had never felt it before. So I'm just like, well, maybe that's what that is. And I still didn't go to the doctor. Um, that night when I went to bed, uh, I woke up, it was about 4:30 in the morning because that pain that I felt the night before, I felt that pain again in my chest. And it was at that moment that I figured, okay, well, maybe I need to go to the doctor. And I had someone drive me to the emergency room. I was like taking my time, like, nothing was going on. But I went to the emergency room, and when I got there, it was full. But when they were asking me questions and I was telling them what my symptoms were, they took it seriously and they took me to the back, which I was happy about because I figured, well, at least I don't have to sit in the emergency room. That's what my thought process was. Never in a million years did I think that I was having a heart attack ever because no one in my family has ever had a heart attack before. So I didn't have any blueprint to go by. But when they took me back, what I noticed was that when I was lying on the table, they were just moving really fast. It seemed like they were moving in fast motion. And then someone walked up to me and they said, Miss Perkins, our tests are showing us that you're having a heart attack. That's how I found out that I was having a heart attack. I'm lying on the bed. What could I do? Because I was in shock. And I didn't think that, that's what was going to happen. I thought that I was going to go to the emergency room, get some pills, and go home. But I ended up staying in the hospital for an entire week. Um, and I had a doctor. There was a cardiologist that they brought in who really did not have any bedside manner. And he wasn't the nicest person to deal with in my condition. Um, and I would ask him questions, and I felt like, he would just kind of brush me off and not answer the questions the way that I thought that they should be answered. I asked him one thing when we got ready to be discharged. Um, he put me on medication. I went in with no medication. I came out with at least 5 that I could remember. And I asked him if I would have to be on the medication for the rest of my life. I said, would I have to be on all of these medications for the rest of my life? And he said, yes, you will. And I was like, no, I won't. I was being defiant because I felt like he was to me. But I told him, no, I won't. And I ended up getting another cardiologist, of course. And I asked her the same question, but her answer to me was, you don't have to be, because with lifestyle change, we can get you off of some of this medication. Okay, that was good for me to hear. I love hearing that one. But After I left the hospital, that doctor never referred me to cardiac rehab, or he never referred me to anywhere. The only thing that he did was he discharged me with medication and told me I would have to be on it for the rest of my life. Um, and of course, I never heard from him again, because I think I switched doctors shortly thereafter. But I didn't hear about cardiac rehab. So that means that I went home, and during my recovery, I didn't know what to do. The only thing that I knew what to do was because of the information that I was discharged with. Take your medications, change your eating, get exercise, whatever it was that was on the discharge papers, that's what I knew to do. I did not know that I was going to become depressed. I didn't know that. um, and I would need a lot of support. I didn't know that. I knew nothing. And so during my recovery, when I was feeling not like myself, of course, later I discovered it was depression. What I did was I started searching the internet because I knew that I wasn't feeling right. And I just wanted to find out what was going on with me. So I started searching the internet and trying to find out, different things about what was going on with me, what goes on with the woman after a heart attack. I remember one day I was at work. It was one day I was at work. Over the course of that day, I kept hearing, maybe it was the course of a week, I kept hearing this one word, Toastmasters, Toastmasters, Toastmasters. I had never heard of it before. I looked it up to see what it was. And Toastmasters is an organization that you can become involved with. It helps you to become comfortable doing public speaking, because I was never uncomfortable doing that until after the heart attack. So there were so many things that I developed after that heart attack. I looked into Toastmasters, I became involved. And I remember doing a speech, and I shared about my heart attack. And there was a young lady there who asked me, have you ever volunteered with the American Heart Association? And I said, no. So I became involved with them. It was after I became involved with the American Heart Association that I started learning about my condition, which I had a heart attack, and that was what my diagnosis was. But it helped me learn how to live after that heart attack. And so I would become involved with health fairs and speaking engagements. I specifically took the speaking engagements to become comfortable speaking in front of people again. Because what I discovered after I went back to work after my heart attack was that I was afraid to speak in front of people. That heart attack took a lot from me, and I didn't know that it was going to do that, but it did slowly. I've gotten a lot back what I lost when I had that heart attack. And that's just because I became involved with so many different things, like the American Heart Association, like the Women Heart Organization. I found out about Women Heart in 2011 when a lady from the American Heart Association asked me, do you think you would like to go to a symposium? She told me about the symposium because she couldn't go. And I said, sure. So I became involved with Women Heart because she could not go to the symposium. But it was when I was at the symposium in 2011 that I learned about cardiac rehab. I had a heart attack in 2005. It took me that long to learn, hey, you should have been offered this. And the things that you went through during that period, they would have taught you those things. They would have told you, hey, this is what you're going to experience. But it didn't happen that way for me. So through the Women Heart Organization, I've learned so much, and I've been able to help other women as well as with the American Heart Association. So with the AHA, I became a national spokesperson for the Go Red for Women campaign. And that was only after I was able again to speak in front of people. And then I became involved with the Women Heart Organization. We set up a support system here in Tennessee. And then we started doing outreach in the community. That's where we had our most successes, when we do outreach in the community, when we create events for the community on behalf of educating women with heart disease. So, like Lynette was saying, with the doctors, I found a great doctor. And I've been having that doctor since 2005. And she does treat me with respect and compassion. If I have questions, she does not mind answering my questions. So I'm very satisfied with her. And again, I've been with her since 2005. So it's been a journey to recover from having a heart attack. And I used to say, well, I just had a heart attack. Listening to Lynette's story, I used to say things like, well, I just had a heart attack. But it wasn't that I just had a heart attack. I had a heart attack. That is trauma to my body and a life-changing event, as well as Lynette's trauma and life-changing events. So I don't want to minimize the fact that I just had a heart attack. I had a heart attack. And that's not something that should have happened. So I educate myself and I educate the community as much as I can. And most of my audience, they are women, but I do have men as well. But my focus is on women because I was unsuspecting. And I don't want anyone to have to go through what I went through. So that's why I share my story.
Thank you so much, Rolanda. And I'm going to turn it over to Lindsay to see if we might have some questions from our audience.
Thank you, Selena. And thank you, Lynette and Rolanda, for sharing your story and taking your experience and turning it into something that you can then go and raise awareness and educate and empower other women who are either at risk of or living with heart disease. What you both do is so inspiring, and major accolades to Women Heart for serving as, a community builder for this really important work. There's a lot that came up during the conversation today. And what I was reminded about is we throw out numbers a lot when it comes to heart disease, but there are very real women with very unique experiences behind those numbers. And that's why it's so important that we continue to get you all out there to share your stories, because some of what you were sharing was really flabbergasting. So I do want to open it up to our attendees today. If you have questions for Rolanda or Lynette or Selena, please feel free to use the Zoom Q&A function, or alternatively, you can use the chat and message us, and we'll keep an eye on questions that come through. There was a comment that came through, a thank you for sharing your story. She says, as a nurse, I know people always need to be treated with respect and kindness. And as a medical professional, we get used to it at times, but we meet a lot of people on their worst day ever, and they've never experienced anything like that. And thank you for what you do. So thank you so much for that comment. I would love to ask both of you, Lynette and Rolanda, was there a specific tool or a specific resource that was particularly helpful to you as you navigated your diagnosis and treatment?
A specific tool. I think that for me, I'm having trouble because I'm getting that echo again, Lindsay. That's why I was having trouble when I was reading. I don't know if you can do the magic again.
We don't hear it, Lynette. So
you don't hear it? Okay. I was very concerned. Okay. So going to the symposium, the Women Heart Symposium, was something that fell on my lap like by chance. This woman that I knew her husband because he was somebody I supervised for years. And when I retired, I offered to meet her because she was having heart problems. Little did I know that she was going to present to me Women Heart. And when she said to me, there's going to be a symposium and maybe you want to join them, at that point, I was looking for something to do after retirement. And I said, this feels so, what's the word? It felt like my next step, like it was so organic. And I was like, I hope that they take me. And so as soon as I began to read in preparation for the for the application, I began to learn. And it opened up this door into a world that I had no idea existed. And that's why I'm so committed to the work with Women Heart. Because as I lead a support group or as I talk to women, I'm learning too, because when they come to me and they tell me about what they're going through, either I have to go and find out about it or I already know some. And so there is this, it's almost like when the bee comes to the flower for pollination, it's such a beautiful like an interchange of information, but also of support. And I think that it's really what we need, is that we're not alone. Because unfortunately, the medical, I mean, they're doctors like my doctor. He had somebody outside the door that would say to him, you need to hurry up. And he would say, stop. And he would sit there with me regardless of how much time he had to be with me. But you don't find that often, that they would take the care and the time to really explain to you what is going on. I'm going to give you an example. The other day, my heart rate went very low. And my daughter, she's 50 years old, so she's not a baby. And I told her, and she said to me, Mama, do you remember what your doctor said to you in front of me? And I said, no, about heart rate. And I said, no, I don't remember. And she said, well, he said that they used to send in the mines, they used to say an insect to see if it would come back alive. So it's the same with heart rate. You know, you have to see how you do by watching how you feel after that happens. So these are little tips that we don't get often when people don't take the time. So I think that's my 2 cents on it. Yeah. It's to have somebody that takes the time.
For me, the tools, I would say, came in the form of those two organizations, the American Heart Association and the Women Heart Organization. And the things that I was able to do with them and on behalf of women with heart disease, just getting out, speaking, just becoming involved with the health fairs. I learned so much over the course of my time with that organization, American Heart, as well as with Women Heart. And like Lynette said, that educational piece, it's like once I started learning what was going on, it made me feel so much more comfortable. It let me know that I was not alone, because I did feel alone, because I didn't want to let my family know that I was suffering at home and feeling depressed, because they had already been through the heart attack with me. So I was trying to learn things on my own. And when I started learning through the Women Heart organization with the material that they have, the different opportunities that we were able to take advantage of. Anytime I'm able to get out there and share my story is therapeutic for me. And I know that it is for Lynette as well. But that's what helped me out a whole lot.
That's great. Thank you. And Rolanda, you said something that sparked a question for me. What do you wish that your friends and family knew about your journey?
I'm slowly disclosing to my family and friends about my journey because I did hold a lot of it in. Um, I wish someone would have known how to help me. I wish that, someone would have been able to tell me, hey, this is what you need, but they didn't know. Because again, no one had ever experienced any of that. So that's one of the things that I do share with people, not just in my family, but outside of my family, because I want people to know the signs and the symptoms so that they know what to look out for and so that they'll know what to do if anyone ever experiences that. Just that small piece of information is really important.
Lynette, is there anything that you wish your friends and family would have known about your journey?
Well, the problem is that the doctors were not giving me a diagnosis. They were not telling me a name. So I was in the dark. And like I said, when I presented my story, there were events, but they never told me what was happening. And I feel so bad about saying that, because why didn't I go to the doctor and say what just happened? Or even ask for my medical record to see what they wrote. Today I do. Today I ask and I say, but I know my father had bypass surgery back in 1979. And my mother was so smart that she took him to Texas. And he did very well. But they never talk about genetics, that we were going to be probably have to be aware of symptoms or take care of ourselves. I don't know if it was that society, the medical society wasn't talking about it. I don't know. I know that today they do. I should tell you, Lindsay, one of the things that I have done with Women Heart is I had the privilege to sit in conferences that doctors do, and they allow for us to sit in them. And of course, I have learned a lot. I'm not a doctor, so I have to be careful. But at least I have an idea from listening to the doctors and presentations, so that at least I have some idea of what a heart attack is, or what a stroke is, and how diabetes is a component of heart disease. And I don't think that people are educated to that level. And I want to say something else. One of the doctors that I listened talking once, she moved from a metropolitan area to a very rural area. And she said she did it because she found out that in that neighborhood, there were a lot of families that were uncommunicated to hospitals or to medical care. And she would get in her car in the morning and visit them in their homes. And that broke my heart. Because sometimes we're talking about people that have access. But this is a big country. And so that's why I feel so honored when I hear from people that are very far away and that don't have those resources. And I wish I could do more.
Thank you. That's a really important point. Selena, I do want to ask you a question, and it's a big ask. I know it's something that you work for day in and day out. What can we do as a society to increase awareness among women about heart disease and the risk
I
factors?
love this question, Lindsay. It's not a big ask at all. You know, Society for Women's Health Research, you guys cover a whole host of different health topics. And I always say that it starts and ends with heart disease. So there are links with heart disease with just about any other diagnosis, whether it's cancer or diabetes or, you know, lung disease, etc. And so I would really ask SWHR to consider bringing in the cardiovascular element to any conversation that you're having, because it always is there. You know, I think for so long, organizations like ours have had to do the work of putting back together the human being in front of the healthcare system, because the healthcare system likes to separate us out into our parts. But we have to do the work of saying it's all interconnected. And we have to, you know, present ourselves and present our missions and present our work as all together, you know, all kind of tied up, because we might be doing ourselves a disservice if we're only talking about one disease specific state. So that's the big thing. And then the thing that you're doing now, this is perfect, bringing us together to hear from patients. I think, you know, across the whole healthcare system, across all of the advocacy that we do, we don't hear from patients enough. And that's a really big mission for us, is to get patients into every conversation. What we like to say, Lindsay, at Women Heart is nothing about us without us. And so that's a mantra that I hope to pass on to any organization working in the health space.
Mm-hmm. I love that, Selena, and we can take that and run with it. In our last few minutes, I would love to do a final round robin. What is the number one thing that you would want our viewers to take away from our conversation today? And maybe, Selena, we can start with you, and then Rolanda, and then we'll end with Lynette.
I would say I would love every single person who is listening today to have that conversation with your friends, with your family, with, you know, when you're in your walking groups or you're, you know, at the dog park. Bring up the conversation. It is our number one killer. Everyone should feel that it is, you know, a conversation that they should be having, right? Because if it doesn't affect you directly, it's affecting somebody that you love. So have that conversation.
And the one thing that I want to leave with everyone, and I usually leave this with people when I do speak, is to listen to your body, because I did not, but I knew something was wrong. I just didn't know what it was. So I don't know if it could have been prevented had I gone to the doctor earlier. I did not listen to my body. So it's very important that we listen to our bodies.
Well, my motto is be positively stubborn. And what I mean by that is that it's very scary to talk about heart disease. I have seen that in every woman that I have encountered. They have to get through that fear to be able to have the conversation. Because after all, we only have one heart. If you look at your body, you have two of everything else. So by bringing up the confidence that there is treatment, that there is the possibility of treatment, and that you're not alone. That, to me, you know, be positively stubborn that you're not alone, that we're together on this fight, and that we're gonna do it till the end.
Wonderful.
Whatever that means.
That's a great note to end on. Again, thank you, Lynette, Rolanda, and of course, Selena and Women Heart for your partnership. We really appreciate you all being here today. and sharing your experiences and your insights and expertise with us. We're so grateful. Thank you for joining, and more to come. Thank you all for joining us today.
Thank you for the opportunity.